Today we are going to cover this particular content, that is development of the face is concerned and development of the palate and the errors of it, which we call them as cleft lip and cleft palate, which is kind of familiar with us. If you see the pictures of them, we see in our clinical life or as well as in our daily life this kind of facial deformity in as we are moved through different parts of the life or society. So this kind of defects of the face and the palate is quite common. So that's what we are starting with the picture of, which I believe you will be able to identify them. And once you understand this particular clinical problem or embryological developmental problem that we are learning with or going through, then it will be retrospectively we can move through. So this kind of error that you are seeing in these pictures, we call them as cleft lip defect. And this kind of defects are quite common because it hits the face region, which is the most prominent part and visible part of the body. And being this particular region which is most commonly presented as a clinical problem in our life, this error of the development of the face, which we call them as cleft lip defect and the cleft palate defect, which is little bit hidden, is quite a common. Can be tested in examination through MCQs and through theory questions. So this kind of defect, as you see this, mostly involves or majority of the time involves the upper lip, and it may have a defect or split in the upper lip one side. We call them as unilateral cleft lip, and if it is falling short to the lip only, not involving this nasal cavity, we call them as partial, and if it is penetrating deep, we can call them as complete defect. Now, if it is helping out, moving out on the right side and the left side as well, we call them as bilateral defects. So these are your exam questions. The pictures are not given in the examinations. Only the narrations will be given, and through the narrations you have to understand what kind of defects you are dealing with and appropriately identify it and answer that. So this kind of defect we call them as unilateral partial cleft lip defect, and this is a complete variety of the unilateral type, and this is a bilateral, both sides of the lip, which is the upper lip, which is commonly having a developmental error. And as I have mentioned, this particular lip defect commonly affects the upper lip. Lower lip defect is really rare. Now, with this particular lip defect, be it unilateral or be it bilateral, it can go deeper and involve the palate. So that kind of palate defect, that means the hard palate and as well as soft palate can be split like this. So we call this clinical problem as cleft lip, cleft palate defect or cleft palate individual. Now if you can imagine, if this palate which is there, if it is defective, the oral cavity has a communication with the nasal cavity. That means the individual who has this defect extending to the palates, the food material they are taking it should be regurgitating through the nose, which is the clinical case they are presenting with. Newborn kids sucking milk from the mothers and regurgitating through nose. That means throwing away through the nose. And what's the clinical defect they want to know, which may have a clinical problem, and embryologically explain it. So the clinical pictures may be like this, and from there we are going to talk about the defects that we are learning here. Along with that, the problem set. Now if you look at this particular gross anatomy of the lip, it is divided in the upper lip into two basic parts. So this middle part of the lip we call them as philtrum. This central part which is lying from the tip of the nose to the under to this particular point, we call them as philtrum. This part is important to understand. Then on the sides of the philtrum, we call them as Vermillion border of upper lip. So upper lip have got two parts. Central part, which has part 1, we call them as philtrum, and right and left border, we call them as Vermillion borders. Now if you go back to the picture, if you remember this, usually what we see commonly, this defect of the lip, we call them as cleft lip defect, usually runs between this margin where this philtrum meets with the Vermillion border. So that gives us a clue about the development of the upper lip. The middle portion of the tip of the lip, we call them as philtrum, is sourced from a source where from these vermilion borders, right side and the left side are sourced from two different sides. And eventually, the central part and the two lateral parts unite and gives the whole lip and the upper region. The lower lip, in contrast, have got two parts, right side and the left side, lower lip vermilion borders, and they are coming from two sources, right side, left side. We do not have an intermediate side over here. So in case of the upper lip, development is little bit different. This upper lip have a central part and two parts, we call them as vermilion borders. They are sourced from two different sides. Now moving back to this particular development of the face. The face development surrounds through this particular opening in the central part. We call them as stomodeum. Now what do you mean the stomodeum? That's the future mouth cavity. The mouth cavity which we are going to have, we call them as stomodeum. That's the central back part. Surrounding that particular stomodeum, we have some elevations or bunches. We call this elevations with the three of them, right, left and the central. So this right left elevations, there are two. We call them as maxillary prominence, right and left. Then at the lower down another prominence surrounding this particular stomodeum, we call them as mandibular prominence. They are easy to identify. The orange shadows and this particular red bumps, right and left. And then we have this particular central white piece of elevation. We call them as frontonasal prominence. The frontonasal prominence have got some complex features. Now, these are the things that we are going to talk about in this particular part. So, this particular frontonasal prominence has a central part. We call them as frontal prominence. And then we have this nasal prominence, right side and the left side as well. So, this nasal prominence, right side and the left side is separated out from the frontal prominence. Now, this particular central frontal prominence and as well as in the right and left nasal prominence, as you can see, they separate out. This is the first phase. And then this particular nasal prominence, as we see here, is having a central cavity develops from this particular central part. We call them a central back part as nasal placode. The nasal placode, which is in the dark shadows we are seeing here, as a central part. As the time progresses, it goes down, or the soil over there, it goes down or buries itself. So, is this particular central part goes deep, the margins becomes elevated, and this circular margin, as you see that elevated, taking a two color shade. One is green, one is the purple one. The medial one and the lateral one can be divided off. So, this elevation surrounding this nasal placode, we call them as prominence, also known as nasal prominence. So, this nasal prominence can be named into medial half and the lateral half. We call them as medial nasal prominence, right and left, which is in the green, and the lateral one, which is present on right and left, lateral nasal prominence, which is in the purple, separated out. Now, what happens in the next half? This medial nasal prominence, the green one, come close to each other and join with each other and forms a central body in the central part. We call them as intermaxillary crest. So, this one we have started with the nasal placode that makes this kind of depression. That depression makes this particular margin elevated, and this depression keeps on elongating. That makes this particular nasal pit. Now, we take this elevation as a nasal prominence, medial nasal prominence, come close to the midline and join with each other. And then we give a new name to this joint part. We call them as intermaxillary process. Now, this intermaxillary process in the central part, which is present in here, goes down. Now, this central blue part, as you are seeing here, receives this particular lateral projections from this orange one. The orange one, we mentioned that as a maxillary prominence. So, this maxillary prominence moves from the right side and the left side, joins with the central glint, which is known as intermaxillary prominence, joins in the midline and forms this upper lip. So, upper lip has a central philtrum part, which is the green, where it is formed by this intermaxillary prominence, which is a fused part of this medial nasal prominence, which is in the central part, and it has a lateral part, this particular orange one, which is coming from the maxillary prominence, right and left. And then whole lip is formed. The central part philtrum is formed by that particular unit. We call them as intermaxillary segment, That intermaxillary segment comes from the medial nasal prominence, and the Vermillion border is formed from the maxillary prominence, from the right side maxillary prominence, left side maxillary prominence. So, this central part meets with this right side maxillary prominence, left side maxillary prominence, forms this upper lip. So, these three units coming together, making this particular thing together and forms this upper lip. The central part, the green one, and the orange in the right and left Vermillion border. By any chance, if you have any movement error between this particular middle green piece and this side orange pieces, we have this cleft or defect present. We call them as lip, cleft. If it is right side, right side. If it is complete, complete. If it is incomplete, incomplete. So, this medial nasal prominence, which is known as intermaxillary segment, failing to meet with right or left maxillary prominence, give rise to this particular clinical defect, which we call them as the cleft lip. We are going back to this picture where we have projected in here. So, in this individual you are seeing here, this is the philtrum. The philtrum part is formed by the green one. What is the green one called? Intermaxillary segment. Where from intermaxillary segment is coming? It is coming from medial nasal prominence. So, right side medial prominence, left side medial prominence. This is forming this central part where I am rolling it. This is Vermillion border, right side, left side. Where from this Vermillion border is coming? Coming from maxillary prominence. So, maxillary prominence coming in here, and in this part we see that this is the left side, the maxillary prominence forming this intermaxillary, forming this Vermillion border to the left side, and philtrum is formed here, but they have a union defect. So, this intermaxillary segment fails to fill with this maxillary prominence of the left side, makes a cleft defect on the side. We call them as cleft lip defect. So, this is how this exam question is coming. What are the segments, or what are the embryological segment failing to fuse, leading to formation of this kind of lip defect in the upper lip, right side, left side, completely, partially, etc., etc. In this individual, you see that the both side we have a defect error. So, philtrum is high up. See that this is a philtrum tissue hanging by, and this side, this lateral Vermillion borders, right and left, they are hanging by. So, this maxillary prominence are formed, and this particular part intermaxillary segment forming this philtrum, but they fail to fuse with each other. That means, in the bilateral case where this maxillary prominence of the right side fail to meet with this intermaxillary segment, also known as medial nasal segment, on the left side and right side, both of the things we are experiencing the same. So, this is how these exam questions are usually surfaced. So, the defect given with the pictures or narrations, mostly the narrations are there, and they want to know how this particular defect is giving rise to this particular sort of clinical problem. We call them as cleft lip defect, etc., etc. So, coming back to this development of this particular lip, the lip is developing, upper side is from three sources. The green one meeting midline, forming a segment, we call them as intermaxillary segment or intermaxillary process. Intermaxillary process yields several structures. It gives to the lip formation the philtrum part. Upper part, Vermillion border, right and left is formed by the orange tissue. Where from this orange tissue is coming? Orange tissue coming from the maxillary prominence. Right side maxillary prominence, left side maxillary prominence. Eventually, they come close to the midline, unite with this intermaxillary segment flawlessly. We get a complete flawless upper lip. If this union of this orange with the green fails to fuse, we have the problem of this lip defect. We call them as cleft lip defect. Right side, left side, complete, partial, bilateral, etc., etc. So, this is about the upper lip formation. Coming to the lower lip formation, so it's completely easier compared to the upper one. We have this mandibular prominence, right side and left side. Right side mandibular prominence, left side mandibular prominence fuse with each other without intervening anything, and makes this particular lower lip and as well as the jaw region as well. So, this lower jaw region and the lip together form the mandibular prominence, the red one, right side, left side. Below this stomodeum makes this particular lower lip, and as because we do not have any intervening complexities in the lower lip cleft defect is rare or non-having because of this particular problem. If you have this mandibular prominence fusion error, we have this lower jaw problem, that means mandible is defectively formed, and as well as this particular lip is not formed as well. So that kind of defect is very rare. So we do not emphasize on those regions where these clinical questions are coming, where the clinical presentation is coming, which is coming to the cleft lip defect. So this is about the development of the lip, upper lip specially, and the developmental error of the lip, which is your exam question, cleft lip defect, which is commonly been asked. Now, we may have even grave variety of a lip defect or facial defect. Now, where we see that, in this particular picture you see that this is the orange shadow which you see here, which is made by this particular point over here is maxillary prominence, which is forming this particular upper lip, and the sides over here, lateral margin, forming the cheek. And this particular maxillary prominence meets with this nose, which is formed by this particular lateral nasal prominence. So nose, this part we call them as ala of the nose. So this ala of the nose meets with the cheek. So by any chance, if you have a tissue movement error where this particular lateral nasal prominence, which is present in here, the purple shadow, do not fuse with this particular orange tissue, which is known as this maxillary prominence, there is a cleft or defect running towards the lateral side of the face. So there is a face cleft, and we call them as oblique facial cleft, where we see a defect running across to the angle of the eye, to the ala of the nose, to this particular lateral border of the lip. So this half of the lip is split. In this rare error, where we have a union defect of this maxillary prominence with this lateral nasal prominence. So lateral nasal prominence forms this lateral side of the nose, where this particular union is defective, leading to this kind of problem. We call them as oblique facial defect or oblique facial cleft. But rather, this is very uncommon, but I am saying it because it's included in the curriculum. But important for us is that the cleft lip that we have mentioned, if you forget about this oblique cleft lip defect, is not going to harm anything, because in examinations it's not very important. In future life, maybe if you land up in that particular domain, you will learn it on your own, dealing with the cases. For the exam purpose, we will emphasize on the cleft lip for now, at this particular level. Now, moving from this particular development of the lip to the development of the nose. So, where from actually we started? Again, we are starting from this particular point. So, frontonasal prominence, we separated out frontal prominence, nasal prominence. Nasal prominence becomes margin raised because of the central part becomes depressed. The central part we call them as nasal placode. The nasal placode grows deeper, forms a pit. We call them as nasal pit, and that particular nasal pit goes digging deep, forms this particular nasal cavity, right side and the left side. So this nasal placode becomes nasal pit and nasal cavity beyond that. So this is how this particular nose is formed, from this particular or nasal cavity is formed. Now, if you look at this particular nose, we have this particular part of the nose which is known as root of the nose, and this part we call them as tip of the nose. And the side of the nose, which is holding the nostrils, we call them as ala of the nose. So nose have got few parts: root of the nose, tip of the nose, which is related to the philtrum, and then we have the ala of the nose. So this central part where it is attached with this, we call them as frontonasal prominence, where it is attaching here. This part we call them as root of the nose. The root of the nose is sourced from this frontonasal prominence. Then we have this septum and the central part, which is extending from the root of the nose to the tip of the nose, which is in the green. The green is formed from the intermaxillary process, which is formed by the medial nasal prominence. So the medial nasal prominence, right side and left side, forms this particular nasal septum and as well as tip of the nose. Left with the ala of the nose, which is holding this nostrils. Ala of the nose is formed by the lateral nasal placode or lateral nasal prominence, which is the purple one. So the ala is formed for the lateral nasal prominence, which is coming in here. And this further lateral to it, where this ala unites with the cheek, which is, we learned about this oblique defect over here. So nose is coming from these three parts. This part, root of the nose, from the frontal process or frontal prominence. Then from root to tip is coming from this particular medial nasal prominence, the green one. Then the lateral part, we call them as ala, is coming from this particular purple shadow, which is coming from the lateral nasal prominence. Now we are left with this particular nasal opening, we call them as nostrils, which is going to the nasal cavity, which is formed by the deepening of the nasal placode or nasal pit. Now, from here, this nasal cavity is created, and from that nasal cavity, it grows and burrows deep. And from this nasal cavity, we have some lateral projections. And from the lateral projections, it creates this particular paranasal sinus. So, this nasal cavity, once it is created, it deepens and widens, and then it moves to the nearby bones. The bones are still young, the frontal bone, the maxillary bone, the ethmoid bone, the sphenoid bone. So, this nasal mucosa invade the nearby bones and slowly grow into it through this particular nasal cavity, and that creates the sinuses. We call them as paranasal sinuses. So, they are paranasal sinuses are extranasal space near to the nearby bones, which is lined by the same nasal mucosa, which is expansions or extensions of the nasal cavities. So, these paranasal sinuses, in the gross you are going to learn about it. So, there are several paranasal sinuses. That means the nasal cavity which is expanding into the bones which is nearby. Out of that, the largest one and the biggest one, or the first one to develop, is that paranasal sinus within the maxilla bone. We call them as maxillary air sinus. So, these paranasal sinuses are nothing but that cavity expansion from the nose, which is going to the nearby bones. So, this is how the nose and the paranasal sinuses, they are formed in this region. So, from this region, we are going to talk about the last segment of this developmental problem. We call them as palate. Now, the palate have got two parts. We are referring here palate development into two parts: hard palate and soft palate. Soft palate is muscular, hard palate is made of bones. Now, this hard palate that we are referring here for the development, because soft palate is a muscular part which is hanging down. So, this is developing from muscles. So, the hard palate development is coming from two sources. The central like a triangular part, which we call them as, this part we call them as primary palate, and then we have these parts of this palate which is coming from the right side and left side, we call them as secondary palate. The secondary palate is of two halves, right half and left half. We call them as palatine shelves. The palatine shelves are used as the secondary palate. So, you have to know the both names of the palate: primary palate, secondary palate, and secondary palate is coming from two halves, right half and left half. We call them as palatine shelves. They are like shelves of a room, they are coming. So, right half and the left half of the palatine shelf. So, you have to know about the development of this triangular area of the palate, and then we have to know this particular later part of the hard palate. We call them as palatine shelf, and they are easy. We already know this part where from they are coming. So, only thing we have to know which part of these tissues are developing into the definitive or this primary palate, and which part is developing into the secondary palate. And again, we have the error, we call them as cleft palate, just like cleft lip we talked about. This error we are going to talk. Now, first we take this part, which is triangular part, we call them as primary palate. Now, you see that primary palate which is present in here, which is in the central part. Now, this central part, as you are seeing here, includes the four teeth. We call them as incisor teeth, 1, 2, 3, 4. So, this incisor teeth and this piece of this particular soft, piece of hard palate, we call them as this primary palate is sourced from intermaxillary segment. Now, what is intermaxillary segment? This is the intermaxillary segment. So, where this medial nasal prominence, right side and left side, you unite, and this union of this right half and left half, this particular tissue, we call them as intermaxillary prominence. So, intermaxillary prominence or process forms already here the philtrum that we have learned, and what else it gives rise, the intermaxillary prominence or medial nasal prominence makes this particular palate. Which part of the palate? The primary palate, this tissue. Along with it forms these four teeth, we call them as incisor teeth. So, coming back, what we have already learned, this triangular tissue which is present involving this incisor teeth in front of this particular slit, we call them as incisive foramen or foramen cecum. This triangular hard palate is known as primary palate, is sourced from this medial nasal prominence. The fusions of the medial nasal prominence, we give a special name, we call them as intermaxillary process. You have to remember this name because in the MCQ, they sometimes give this medial nasal prominence and sometimes they give this intermaxillary prominence, one step ahead. So you have to know this meaning of the medial nasal prominence and you have to know about intermaxillary prominence. What do you mean by exactly about them? So the intermaxillary prominence is nothing but fused this green guy. So medial and lateral nasal prominence fused, we give a special fused name as intermaxillary prominence. Intermaxillary prominence forms the philtrum part of the upper lip, forms this particular primary palate and the 4 incisor tooth from here. That's what you have to learn in this particular palate development. Now, where from this particular black shadows are coming, which is known as this particular palatine shelf, also known as the secondary palate. The secondary palate is coming from this orange tissue. What do you mean by the orange tissue? We call them as maxillary prominence. So this maxillary prominence, right side and left side, go in the midline and fuse in the midline and forms this particular definitive palate which is present on the back side. We call them as secondary palate. So this primary palate fusing with the secondary palate forming the whole palate, we call them as developmental palate or definitive palate. So this particular palate is sourced from 2 parts. Primary palate, where from it's sourced from intermaxillary segment which is coming from the medial nasal prominence. Where from the secondary palate is coming from the palatine shelves. Where from these palatine shelves are coming, it is coming from this particular maxillary prominence, right and left. And eventually, these primary palate fuse with secondary palate likewise and forms this particular whole palate, which is the adult palate. We call them as the definitive palate. Now, what can go wrong? The fusions of the primary palate with the secondary palate may have a fusion error. Fusion error between the right half of this particular palatine shelf with the left side palatine shelf may be erroneous, can lead to this particular defect. And if we have defect in the fusions, we get this particular problem as cleft palate. So this is what we started off. So cleft lip, what do you mean by cleft lip? Unilateral cleft lip, right side or left side, primary. Cleft lip may be involving this upper lip. It may be just like involving the right side, left side or both sides, bilateral sides like this one which you're seeing here, both sides affected. This one is unilateral affected. Maybe primary, this one is like a partial or complete depending on how much penetration it is having. This is a lip error. This lip error may be associated with the secondary error of the cleft palate. That means the palatine shells, right side and left side, fails to fuse. So they may have a defect between the palate, resulting in what? The oral cavity is communicating with the nose cavity. That means food material from here can go to the nose and can regurgitate back. So the drinking water from the mouth and coming back through the nose. That is what is coming. So this may have a problem here with this particular problem. We call them as cleft palate defect. Now, if this cleft palate is partial, we call them as partial. If it is splitting all the way to the soft palate as well, we call them as complete cleft palate with the complete cleft uvula, where uvula is split as well. Right side and left side, no match. So you see that particular picture over here, there's a mouth cavity. You see that there's a slit over here present on the posterior half. So this posterior half of this particular palate, right half and left half, is not meeting in the midline. That means the maxillary prominence is not meeting over here. Here we have this cleft palate where it is slit all over. That means from the front to back, from this particular front side to the back side, it is all unfused. That means the palatine shape and this particular primary intermaxillary segment is also erroneously fused, that leading to the complete cleft palate and along with the cleft uvula. The uvula is split right side, left side as well. So how the exam questions may be coming? They may ask about this particular cleft palate as an exam short note, cleft lip as an exam short note, how this particular cleft lip, cleft palate is there. You have to explain what do you mean by cleft lip, what do you mean by the cleft palate. Now how common they are? They are common. Cleft lip is more common than the cleft palate, of course. Male individual suffers more than that of this kind of error compared to the female subjects. Pregnancy with the aged pregnancy have got more incidence of this kind of facial defect. We call them as maxillofacial defects. They are common. This particular cleft palate may have association with taking of some drugs. Mothers taking some kind of drugs may have this kind of increased incidence of this particular fusion defect. These are the things that may go wrong. You do not have to know about these particular facts about what are the drugs or etc. may be linked up with. Do not have to know about, but embryologically you have to know what creates this kind of error defect and what creates this kind of error defect. So that means embryologically what goes wrong with this particular fusion defect like maxillary prominence or this kind of problem with this particular intermaxillary segment, etc. etc. So this cleft leaf, cleft palate out here is the important for your undergrad questions, MCQs, and as well as this exam short notes. They give questions related to it and the problems related to this particular error of this particular nose development, which is related to this. You have to know the parts of the nose. That's what they ask for. This is known as root of the nose, tip of the nose. This is the nasal septum, and this part we call them as ala of the nose. So which part of the nose, if have got any defect related to it, may have that related defect or anomalies. And they want to know about this particular fact about paranasal sinuses. What do you mean the paranasal sinuses? We have a gross lecture class on it, but as well as practical class, of course. The paranasal sinuses, that is expansions of the nasal cavity towards the nearby bones, and this expansion starts early in the developmental phase. Out of the paranasal sinuses, the earliest one to develop embryologically is the maxillary one. This is the MCQ that keeps on asking about. The paranasal sinuses first to appear or the largest one to have is maxillary one, and this particular paranasal sinus communicates with which opening? Through the nasal cavity. So this will be covered in the gross and practical classes as well. So to summarize in this particular fact that we have to know about the development of the face, that we have to know about this particular fact of development of the lip. Upper lip developmental error, this is the most high yield of it. How from this particular upper lip develops, Philtrum and as well as the Vermillion borders and the lower border of lip, how they are coming. And remember this opening of the mouth that we call them as stomodeum. Surrounding the stomodeum, we have these particular elevations and these particular changes takes place.